Hello, guys. This is Dr. Palaniappan Manickam. Everybody was asking me this question: what to do with this preschool kids, young kids who has been having increasing COVID-19 these days, has been exposed to this infection, and the preschool period is starting. So I am not an expert in this. I'm not a pediatrician, so I was not able to answer these questions. And as you know, most of the times, if I don't know, I will bring somebody else who's my friend who can answer this question. And I can't think of a better person than Dr. Ambika Chidambaram. She is a pediatric pulmonologist. I mean, she's doing a fellowship in this specified specialty. So, which is, we are so glad and honored to know her. And I'm so thankful for you to spare your time for our audience as well. Thank you, Ambika, for coming on the show.
Thank you, Pal, for having me. I'm really happy to share my views today.
Perfect, perfect. Me and Ambika share a common denominator that both of us have a 1-year-old kid. So we share the exact same concerns like all of you guys as well. So I'm going to represent you, like the audience, and I'm going to be a layman, which might be true, and then ask Ambika about what are general concerns that what we have. So the first question, Ambika, is everybody is scared about this Delta variant in COVID-19 in kids, and people are opening up the school back again. Is it safe to send the kids to school? So let me ask you a personal question as well. If it was your kid, you have a 1-year-old, let's say you have like a 7-year-old, will you send your kid to school, and at what circumstances?
So, Pal, that's a very important question for us to ask ourselves as parents. And if you think about it, it depends on a lot of things that you would consider before sending your kid to school. Now, with the Delta variant coming around the US and India recently had the hit as well, we do not have vaccines for the children less than 12 years of age. So, what antibodies that we adults have from being vaccinated, they just don't have that capacity to fight the infection. With that being said, when you go to school, you do have teachers, other people who work in the school, nurses who are eligible to get the vaccine. So before considering to send your kid to school, that is one thing that I would ask your school management to see if the school personnel are all vaccinated. And secondly, mask mandate is very important. And that is something that the CDC website has also recommended to all of us. So all the children above the age of 2 years of age have to wear a mask. And what we have learned over the past year and a half with COVID being really rampant around is that by sneezing or coughing, basically respiratory droplets is the main form of transmission. So if you cough or sneeze and you don't have that one layer of protection around your nose and mouth, it's where COVID is going to spread, that particular virus. The other ways is basically through contact. So if you sneeze into your hand or cough into your hand, or even if you just like wipe your secretions from your nose onto your hand and you touch a surface or somebody else, then you basically are just handing them over the virus. So hygiene, hand washing, and masking is going to be very important when you consider to send them back to school.
School.
And also just screening at home. If your child has a runny nose, cough, or any signs or symptom that they're not feeling well, even with vomiting or abdominal pain or diarrhea, those are things to consider to see, should I send my kid to school? Are they going to infect other individuals? So I think it's very important to have a conversation with your pediatrician and with the partners that are involved in taking care of your child, when you can weigh the pros and cons of whether it is safe to send your child to school. In the United States, each school district has their own set of rules
Rules.
and regulations that they would follow. So I
Mm.
think it is very important to have good communication with your school management and also have a plan in hand. If things don't go the way that you did, have a backup plan to keep them at home.
So everybody is concerned that let's say if you don't get sent to school, their mental health, their socialization skills, there are some benefits to school as well besides free food in the cafeteria.
Absolutely. I think education last year itself has taken a turn, and mental health has definitely been an issue. We have seen a lot more depression and anxiety and just
Even in kids, huh?
socializing,
Even in kids.
even in kids. And
Mm.
those who also have like a condition that their health doesn't allow them to do a normal life, like if they have asthma, just as simple as that, or if they have cancer or any long-term condition, anything that that it doesn't allow them to participate in normal life. COVID has been terrible, or what to say, hard on those
Right.
kids.
So you have to weigh the risk and benefits.
Yes,
Mm,
yes. And
mm,
sometimes, so we have improvised over the past year as well. In some families, I've heard that they would gather like 6 to 8 year olds within their social bubble and have like a tiny school, but it's all virtual.
right.
And some kids who are vaccinated, at least those between 12 and 18, have had like a hybrid where they will go 2 days and stay at home for 3 days. And that has worked as well. So I think
Mm,
each family and each child is different. So you'll
mm,
have to see what works best for you and
mm.
cater to that need.
So you will say that the risk is not zero, but it is very low. And let's say that it based on your individual kid as well. So let's say that that kid has immunocompromised condition,
Mhm.
then they're at a slightly higher risk of getting COVID-related complication compared to a healthy kid.
Yes, and that goes with the vaccination rate. Let's say they were eligible for a vaccine and they had an immunocompromised condition. Then we don't know how much the vaccine protects them as well.
Mm,
So there is
mm.
a catch 22 there. So basically, you have to weigh the risks and benefits again
Yeah,
and again
right,
and see whether you can, how you can protect your child the most. Because
right.
it falls down to the parent to make the decision. And fortunately, now we're getting more and more information. Over the past month, there have been a recent rise in cases in children. We are yet to see the long term effects of Delta variant,
Mm, mm,
just to
mm.
give you that
Right.
data.
Caveat.
And there is actually an inverse proportion of cases. Now, those who are the elderly age group 65 and above, the cases are dramatically decreased.
Mm.
Young adults are 95% affected, followed by our little kiddos. So the cases are rising. We are yet to see the serious cases.
These cases, right? So you are a pediatric pulmonologist, which means that you see the sickest of the sick patients, right?
Mhm.
But in overall, like a general pediatric practice, what is the likelihood of COVID-19 recovery, even in the worst case scenario that if my kid gets a COVID-19?
So majority of kids do okay. But
Hmm.
we do see a good handful, at least 80% of our patients who had COVID, who were otherwise healthy, who just had mild asthma, did well during the active COVID time. They did not
Hmm.
need hospitalization, maybe an ED visit.
Hmm.
But right afterwards, they have been having hard time with recovery. Majority of them complain of fatigue. We have seen
Hmm.
children come to our office with trouble breathing,
Hmm.
especially with exercise. And we don't know how long it takes for them to come back to normal. So
Hmm.
there are long-term effects of COVID even in children who did not have a serious infection or illness because of it.
Because of
So I would advise all parents to be on the lookout, be vigilant about what is going on, and just don't take things lightly. It is something that we really need to take seriously.
Okay, okay, okay. So, vaccines might be coming up maybe in 2022 for this between 2 to 12 years of age. But how about this 12 to 17? Pfizer vaccine has been approved. And
Mhm.
what is your take on that myocarditis risk that we have been seeing?
So, to be honest, personally, I have not seen a case of myocarditis or pericarditis yet, but I have heard about it. So,
Mm,
there is an organization within the US called Vaccine Adverse Event Reporting Surveillance System. So,
mhm,
any adverse event that occurs with a vaccine, we are responsible to report it to the government, and they
mm,
keep track of all the cases, and that is how this has been picked up. And
mm,
in review of what has that they have received thus far and been published is that mainly older adolescents male have been affected, but the recovery has been very quick. So if you compare the effects of COVID compared to the effect of the vaccine, the effect of preventing COVID definitely outweighs the risk.
obviously, right, right,
So,
right.
personally, it would be my recommendation to continue to get the vaccine as recommended by the government.
Right, right. So there was an increases for myocarditis the second dose. I think more data is saying that the likelihood is even low. But in the worst case scenario, let's say that you are that unfortunate patient, you get the myocarditis. The
Mm.
recovery rate of myocarditis has been extremely good as well. I have confirmed that
Yes,
with my pediatric cardiologist as well.
excellent.
Going back to the school
Mhm.
topic. So based on your discussion, so the risk is out there because of the increasing Delta variants.
Yeah.
what are the precautions that you could take practically applying to kids? For example, we know that we have to wear mask and hand washing and social distancing, but it's very difficult to incorporate that in a 3-year-old or a 4-year-old. What is
So,
your recommendation?
so surprisingly, kids are doing much better with masking.
Hmm. Hmm.
So today, my son is just 15 months old, and if he sees a mask, he gives it to me and asks me to wear it. So if a 15-month-old can understand it, a 3 or 4-year-old is much more advanced. So it depends on how we teach them and tell them how to use it. So if
But your son is a son of a pulmonologist.
even so, like he does not know that.
Right, that's true. That's true.
Yeah. So it depends on how you reason with it. Make mask like a fun thing,
Hmm.
and you'll be surprised that kids actually understand more than we know. And
Hmm.
if you continue to use it like with fun times, what we say is when you're watching TV or if you're doing something fun as an activity, just have them wear the mask on. And if you do it every single day and tell them this is something you have to do, it becomes a habit. So you actually protect yourself and your child from getting COVID-19.
Got it.
And one point I wanted to reiterate is that let's say you as parents are vaccinated, so you have more freedom than the child who is unvaccinated, which you have to deal on a daily basis. So I would say weigh your risks and benefits. If you're going to a social gathering where you're going to see all vaccinated adults and it's within your social bubble, then you can unmask and go for the guidelines. But
Hmm.
if not, I would be more um, take the
Cautious.
precaution, yes,
Hmm.
and make sure even though you are vaccinated, you wear the mask as well. And for those above 2 years of age, start early on. Just as we wear seat belts when we sit in the car, and we brush our teeth every day, and we dress up to school. Those are certain things not taught to us because we have to do, but it's part of life.
Hmm. Hmm.
Fortunately or unfortunately, mask is going to become part of our life, and
Hmm.
that is
Hmm.
how we should put forward to our children.
And tell us about hand washing as well. How do you do that in your patient population?
So hand washing is something that I've always done with my patients before I see them in clinic, and that's part of how we are taught with infection precautions at work and in school. But daily, I think that has to become part of the routine as well. So whenever you
For
go
kids.
out for kids, so
Hmm.
if they go use the restroom, which we already tell them you have to wash your hands after using the bathroom. And for older kids, you can teach them how to use the hand sanitizer, but not for the younger ones because there have been
Hmm.
cases where they have overdosed on hand sanitizing materials and things like that. So
Ah.
hand
Hmm.
washing, though it is the best way to prevent contact transmission of COVID-19.
Hmm.
And
Hmm.
make sure you have like a station at home where you just have a basin. Make hand washing fun like anything else. You can have like a hand washing music that you do every time you wash their hands, or sing a song when they wash your hands, and just make it part of the routine. And
So whenever they go out, when they come in, I think the first step is to hand wash.
yes.
Yeah. Hmm.
And if the number of cases of COVID-19 are high in your community, you may want to take an extra step of changing their clothes as well.
Okay, okay, sounds good, super. So those are excellent tips, excellent tips. And
Mhm.
then, so we talked about the social distancing as well. That if you are in a vaccinated bubble, it is reasonably okay. But let's say you are going to an Indian grocery store, if it is
Um,
slightly packed, you are at an increased risk.
yes, any indoor crowded area, it is a high risk area. Any outdoor crowded area is also a high risk area. But if it's pretty much less crowded and everybody are pretty spaced, then you can continue doing your normal activities.
Right.
Just be smart and vigilant about what you do.
Right, right. So again, you are a pediatric pulmonologist and
Mhm.
you've been seeing COVID cases for the last 1 year. So
Mhm.
just wanted to give my audience an idea about what can be a long-term complication it is. I'm not going to scare. I'm
Mhm.
not asking the question to scare people off, but I think they should understand as well that we know that majority, like 95%, it will be okay. So don't worry too much about it because the ACE receptors in the lungs, which is required by the COVID-19 infection, is very minimal in kids.
Mhm.
So the likelihood of them having a complication is low. Again, I'm emphasizing it is very low. But in the worst case scenario, if there is a complication, in your experience, what have you seen?
So, in my experience, I've generally seen the older age groups who have had COVID-19 in a serious complication. And
Mm,
majority of them have had like pre-existing illness. Either they can
mm,
have like an immune system that is not functioning well. It has been shown that kids less than 1 year of age as well have been very much affected. That
mm,
being said, my experience has been outside the Delta variant. The Delta variant is a whole different show at this time. We really
mm.
don't know how much the ACE receptors play a role with Delta
You're
variant
all
as
right,
well.
right, right.
So we are
Mm,
still learning about the Delta variant. Kids are at high risk because they are unvaccinated and they don't have the antibodies to fight infection like we adults do.
that is true.
There is some speculation that because certain kids, not all, have been exposed to other viruses, and there is some cross reactivity in giving protection to COVID-19 as well. But that has not been proven in like really robust research yet. So
Mm.
I would be still take precautions and be very cautious with your daily activities.
Right, right, right. Sounds good. So, so last question is, do
Mhm.
you, so let's say if your kid is healthy,
Mhm.
it is okay to take the risk to send the kid to school, or you will avoid school at this time?
So if my child is healthy
Mm,
and otherwise the entire community, the vaccination rates are high and the school is taking the adequate precautions, then I would say talk to your pediatrician, make sure that what you perceive has been occurred in your community is
mm,
actually occurring in your community, and
mm.
then take the decision to send them to school. So it does not have to be just you who makes a decision. Talk to other parents, see what they know, talk to your school, talk to your pediatrician, and then make that decision.
Super, super. Thank you. Thank you so much. I was trying to trick you with all these questions, but you were coming up with the solid answers all the time.
Okay, I'm glad I was able to help you.
Perfect. Thank you, guys. So, bottom line is I'm just going to do some bullet points here. Number
Mhm,
one, the risk of COVID infection complication is low, again, low in kids. But number two is because of the Delta variant, we just don't know what is the data
mhm,
available. So, it is always better to be on the precautionary side. Number three is it doesn't mean that you don't have to send the kid to school. It's based on individual risk and benefits ratio. Please discuss with your
mhm,
pediatrician, local community of how much people are vaccinated. Then it is okay to be in a social bubble where everybody is vaccinated. But if you are
mhm.
going outside in a grocery store or any public place, especially indoor gathering, please make sure that all kids more than 2 years of age get wear mask. And then it is okay for the Pfizer vaccine for 12 to 17 years of age. The risk of myocarditis is extremely low.
Yeah, I would just
Mm.
like to add one point if that's okay.
So absolutely.
So, with COVID happening this past year, typically in the US, in the winter time, we see a rise in other viruses infection. So, basically, like respiratory syncytial virus, otherwise called RSV, adenovirus, parainfluenza virus. There are so many others, even including the flu virus, that can affect children, and that we usually see a high ICU admission rate and hospitalization rate and ER visit rate. But this past year, we have seen that more in the summer. So
Mm.
even though your child may not be exposed to COVID, there are other viruses circulating in the community. So when you decide to go visit a family member or like a friend, be open and asking about if anyone has been sick in the past 2 weeks. Ask them if anyone has any upper respiratory symptoms like runny nose, congestion, fever, body ache, including nausea, vomiting, abdominal pain. If Be honest, disclose if you have had any of the symptoms. In that case, postpone your visit.
Mm.
Some individuals recently have been calling themselves having runny nose, congestion, cough as allergies. It may very well be allergies, but sometimes viruses can present the same way. So, if you're going to meet with kids and you have those symptoms, just have that self responsibility to either disclose so that you can protect children from getting this virus and prevent admissions from other viruses than COVID-19. So, just be
No,
vigilant
absolutely.
about that as well.
I think the same concept will apply to daycare as well and to school as well. That, let's
Mhm.
say that your kid is having a light, mild cough or mild allergic like symptoms, don't disregard it as allergy. And I know it's very difficult to
Mhm.
accommodate and, I know the pain of not sending your kid to daycare, about modifying your schedule, but I think everybody should have that self responsibility at this time.
Yeah.
It's just that you don't give Tylenol for fever, go to daycare for 4 hours, and once they call for fever, then you come back again. I have seen that happening in so many times. That is
Mm-hmm.
not socially and ethically right, especially in this situation.
Yeah.
So, so please be more, please be add that extra self responsibility. Similar
Yeah.
to your kid, everybody have their own kid as well.
Yes.
So thank you so much for bringing that point as well. And again, we go for potlucks and everything within the social bubble, and
Yeah.
I know that chicken biryani is so appetizing. But I think if you're sick or if you're having any allergic symptoms, please disclose to the group as well.
Yeah. And I
Super.
think that should just become a normal part of life, at least for the next few years while we fight the transmission of COVID.
Transmission, right? Sounds good. Super. Thank you so much, Ambika. This has been
Yeah.
super phenomenally good session, and I'm hoping that I'll bring you back again for like in a month or two for an update about this Delta variant in kids. Again, thank you so much for your time.
Thank you so much for having me.